My name's Susan Scollie, and I'm a professor in the audiology program here at Western. I mainly teach in the hearing aids related coursework. In my day-to-day teaching, as you can see, we have put a lot of work into setting up a hands-on experiential learning space for the students, so they can actually come in here, and we've got real clinical equipment, and we do real hearing aid fittings with them in here so that they get lots and lots of experience with different levels of hearing loss and different brands of hearing aids and all the competencies they're going to need to go into clinical practicums. In the past, we would have them do a little bit of practicing by fitting on each other. There's a real set of limitations around that. For hearing aids that are really powerful, that's not really a safe or comfortable thing to do, so we would never do that. So there was a whole sort of category of simulated fittings that we really didn't have a way of going to in this kind of an environment. We did our best, we had some alternatives, but nothing like this, right? So with this, we can put hearing aids on a simulated person, and it doesn't really matter how loud or powerful they are. We can do the full range of everything that people need to know for their clinical practice and run into all of the challenges and successes and everything like that. It's not a real person. He's not giving us feedback on if he's happy and things like that, but there's a lot to be said for being able to step through, start to finish, everything that you're going to need to be able to do. I think the biggest difference pre-CARL to post-CARL is I can see when they're going to make a mistake across that whole start to finish process. So we can do a more complete representation of hearing aid fitting because we've got a person, and if they put the right ear equipment on the left ear or something like that, then I can see that in a way that I wouldn't have been able to before. So we can pick up on mistakes, we can practice. That's one really good thing. We can do things wrong on purpose. So actually misfit and do bad quality fittings, poor, like mistaken fittings in some ways, and see what that would look like, see how to recognize that. Feedback would be one example. So we can put a hearing aid fitting on in a way that's not a good fitting and the hearing aid is whistling, which is something that you see happen a lot, and how to recognize that that's going on, how to see what that looks like on the measurement equipment, how to reprogram the hearing aid or refit the hearing aid physically to overcome that. I wouldn't put a real volunteer patient through that because it's not comfortable to be sitting with your hearing aid whistling away, but CARL doesn't mind, so we can do things wrong on purpose and learn from that. The students also talk about being able to come in and practice on their own. It means they don't have to have a practice partner. They can come in and say, all by myself, in the peace of my own time, can I come in and make sure that I know how to do this set of procedures. So uses for CARL beyond just training. I think it's useful for instructor preparation, so it lets me get ready for a teaching thing because I can dry run it too, or I can make a video, or I can set up exam stations. So it's not just in the moment teaching, it's actually getting ready for that. We started using it in the research context for if we need to check something about equipment, or we want to see if two pieces of equipment give us the same measurement as each other, that kind of stuff. Teaching a research assistant maybe how to do something in the research context. So there's been all these side benefits, little things that maybe would take your time or that would be inconvenient. It gives a really straightforward way to check equipment. We're currently in the middle of the COVID-19 pandemic. Last year we had CARLs at every station. Typically what we were doing is having two students share a CARL and share a station. But they were using CARL for quite a lot of the laboratories. This year what we're going to do is we're going to have one student, one CARL. So I guess the nice thing about having enough CARLs here that we have them per station is that we can actually do that. If it wasn't for that, if we didn't have CARLs at each station, we'd be losing them being able to practice on each other, and there wouldn't be a way to substitute in for that. So basically what it means is we're okay, and we can run our experiential learning course the way we've always run it. And in some ways it might be better having one student per station in terms of assessing individual competency. Yeah, I mean, I think a lot of people are talking about increasing experiential learning. In talking to people who are going out on placement, I know it helps the students feel more confident. I think that's a benefit that we don't really think about enough as instructors. Another thing I would say is they are really sturdy. A lot of the CARLs that you see in here have been in here for at least 3 years, and we haven't had one ear break yet. So in terms of being kind of worth the investment or something like that, I think it is. It gives a way to assess competency in a really realistic way. You can be more sure that that somebody can execute a whole set of procedures, not just with one part of the equipment, but with like the person involved in positioning everything. And there's just a lot of little micro competencies in there that are really, really important. And it gives you a direct way of assessing that. It also gives you a fair way of assessing that because you can create multiple equivalent examination stations. I guess for programs thinking of doing more in the way of experiential learning, you can think about it in terms of instructor preparedness, in terms of lab activities you do with your students in terms of students practicing by themselves, and you can think about it in terms of examination. What we've seen happen is once we started using it for a few things, that sort of blossomed into using it for more things than what we'd originally envisioned.